I think we need to move past this understanding and belief that it's always on the female. 40 to 50% of all fertility issues are male factor in some way, and we need to start addressing it more than we do.
Welcome to Max Wellness. Today's guest is Marc Sklar, the fertility expert. He's a doctor of acupuncture and Chinese medicine. He studied mind-body medicine at Harvard Medical School. We talk about fertility and how it's tied to overall health, and how over almost 20 years now, he became a fertility detective. Enjoy. Keep in mind that this is for information purposes only. This is not medical advice. Please consult your medical doctor prior to implementing anything mentioned in this video. Thank you. I have Dr. Marc Sklar with me today, the fertility expert. Thank you so much, Marc, for being with me today. I'm super excited about our interview.
Yeah, me too, Maxim. I'm excited to be here and happy you reached out and invited me on your show.
Yes, well, I really love your content, your channel on YouTube, the Fertility TV, and I really love your message about natural fertility awareness. And you've been called the fertility detective also. And it's been almost 20 years from what I see also, your whole journey. You're a doctor of acupuncture and Chinese medicine. You studied also at Harvard Medical School, mind-body medicine. And I think you're the president, I don't know if it's still actual, but of the American Board of the Oriental Reproductive Medicine. Is that right?
That all of that is correct, with the exception of August 1st. I am no longer the president of the American, but I'm actively involved and a big advocate for the organization. So and been involved with them since their inception. But yes, I'm no longer the president acting now.
Okay, but you're involved, yeah. In this whole all around really like fertility in a very holistic way, traditional Chinese medicine way also. And I'm very curious on your journey, basically your own personal story. How did you become, did you always know that you wanted to be a fertility expert? How did that come about? I'm super curious. So if you could go over that, I'm sure the audience would be very curious also.
Yeah, it's a funny and interesting story. And I think the first answer to your question is no, I didn't always know. I always knew that I wanted to be in medicine, and I was gravitating towards women's health and hormones and endocrine disorders, but I didn't really specifically think that it would be fertility related. And there's a lot of curves and turns in that journey, specifically as it relates to my mentors and who was guiding me through that path when I started school. And it just seemed like a natural progression because of the providers that I was working with and mentoring with, and that's what they were doing. But really the main piece that pushed me over the edge, and where I really said to myself, for sure, no question, this is what I'm going to do, was when I was in my last year of training, and we were in the clinic at the school where we would just open it up to the community, and they would come in and visit with us and get care. And all the patients that would come in to see me were all focused on women's health and fertility, whereas everybody else was seeing all sorts of other things like pain and digestive issues and whatnot. Like 90% of what came to see me, without any marketing or effort on my part, was within that field. And one patient specifically who came to see me was a woman with PCOS, polycystic ovarian syndrome. And she had been trying for a while, but she had irregular cycles, and she wasn't able to regulate those to be able to ovulate normally and be able to get pregnant. And I think it was about 4.5 months, maybe 5 months. I might be off by a few weeks. When she came in, and we had gotten her cycles regular, and she came in, she's like, Marc, my cycles are not regular anymore. I missed my period again. It's too long. I don't know what's going on. And she was all upset because she thought, she was back to where she was because her cycles were irregular again and her hormones weren't working. And I said, why don't you before we start worrying about this, why don't you do me a favor? And here's a pregnancy test. Why don't you go to the bathroom and take a test? And she came back, and she was very surprised because it was positive. She was pregnant, and she couldn't believe it. So wow. 4.5 months into it, she was pregnant, and that really changed everything for me. Just one, I get the chills now as I say it, but like now she comes in, I was able to help her correct and manage her PCOS, and in turn, she was able to conceive and have a child. And actually, I helped her with her second as well, and that really dramatically changed my life. For as much as I helped her grow her family and so forth, which is really profound and amazing in and of itself, I don't think she realizes how impactful she was not only to my life and my career, but to all the other thousands of couples that I've worked with and helped and supported throughout the years, because I don't know what would have happened if that didn't happen, right? I don't know where I would have gone and what I would have specialized in, but really that moment pushed me into this direction and really changed my life forever.
I love it. I love it. And it must be so, as you say, rewarding. And also, I love how your message also from seeing all your content is how it's all interrelated to general health also. And all these conditions, not only is it stressful and on parents and women, and sometimes when they have also other conditions underlying like PCOS, fibromas, all those things, endometriosis, many times, it's kind of like they're doomed and they're like, okay, I won't be able to have children, or like, so it provides hope. It doesn't mean it systematically is simple, but still, I love how by being this detective, it really implicates many holistic health principles, integrative medicine. And this is where I think it really shines. So people will not only have those symptoms get better, ideally, and if they can have this family, this is really priceless. So, and this is what I really want to dig deeper with you into, is really the prevalence, first and foremost, like the prevalence of infertility. Seems to be more and more there. I don't know if you have some numbers, but the 21st century, is it more, do you think it's more getting more diagnosed? Is it more misinformation about how really fertile a woman is? Or could you elaborate on that, like the prevalence of infertility?
Sure. I think it's multifaceted when we start looking at these numbers and the diagnosis of infertility conditions now than they used to be in the past. So I think the numbers last time I looked roughly are 1 in 6 couples are struggling with fertility issues. And I'm sure for those couples who go through it, they might even say, oh, I think that number's higher, maybe 1 in 4. But it's a relatively high number. Now, I think the tricky piece here is to say, is that more common now than it used to be? And if so, why? So I think there's a couple of things that go on here. One is fertility issues were very, very taboo many years ago. If we're talking about the 60s and even the 70s, people didn't discuss their fertility issues openly. Not to mention, we didn't have social media to help spread the word about it. But it wasn't something that was looked on positively as something that would, people could easily discuss. I mean, in many ways, people even don't feel comfortable discussing it with their family, right? Even in a close family, it's not something that they necessarily want to share and discuss. So I think that's one piece of it. And so now in the time frame that we're in with the advent of social media and the way information is spread now, we spread information much faster and much easier than we used to. And so as part of that, I think we hear more about it. And so I think that's one aspect. So I'm not so sure if it's always that, yes, it's being diagnosed more, or are we just talking more about it and we're more comfortable discussing it? Because we certainly are. Couples are much more comfortable talking about it now. Not everybody, but in general terms, it's much easier to discuss it and bring it up as an issue than it used to be many years ago. Okay. And in a lot of cultures, it's still taboo because, you can't have a child. What do you mean you can't have a child? You should have had children years ago and you're too old now, whatever wording that they use. And so that can also be an issue there. Now, on the flip side, I do think that we have more influences impacting our fertility negatively today than we did years ago as well. So I don't think it's all just the fact that we're talking about it more and we're educated more about it and we're more comfortable talking about it. I do believe that there are variables in the world that we live in today that we didn't have before that are absolutely impacting our health and our fertility and reproductive system and endocrine system. And I think that's no more prevalent than when we start talking about environmental toxins. I'm not sure in Canada how those things are handled and managed in terms of chemical exposure, but in the United States, it's managed very poorly. Almost anybody can use chemicals relatively freely, however they want, until it becomes so much of a problem. Then at some point, the government's going to step in and say, now we can't do this. And even then, if their pockets are lined enough, that takes too long. So, I think those environmental exposures are a big issue for our overall health and certainly our endocrine system. And, I'm looking outside right now, and when I look at the yard and just think about what people are using in their yards and the chemicals and pesticides, let alone what farmers are using and what we're ingesting and breathing in, all of this is a huge variable that I am dealing with more and more, and wanting to investigate more and more and having to support more and more with each passing year.
Yeah, for sure. And I can definitely see like the 21st century. And even from my personal experience, I see my neighbors like spraying their lawns, and I live next to a golf course, and like all these things, even if we know that glyphosate and all those pesticides have some impact. And it's hard to say like what is what, but it definitely can have a cumulative effect on our system, on our hormonal health, like the food supply and like the food quality and the environment, as we said, but also the lifestyle in the 21st century, which is more and more stressful to our hormones and body overall. And also like the blue light and like all these things. It's never like really one thing, but it all adds up to create stress to our bodies. So and it makes me think of the Pottenger Cats study. I don't know if you're familiar with it, but like over a few generations, those cats would like lose some motor skills and even not be able to reproduce at the end. I'm not saying it's exactly how it works on humans, but it's a very interesting analogy and little study, we'll call. So
that one is actually really that topic is really fascinating to me, and something that I don't think we think about enough as individuals when we're making decisions. But I know that our ancestors did. They would often think about, how is this going to impact my decision today? Will this impact my next generation or even generations beyond that? We don't think about it as much, but absolutely, I agree with you. I do think and know that, our grandparents' genetics are influencing our health today, and we have that same impact on our generations that we're creating in the future. And I think that's a really profound and hopefully empowering thought for many people listening, that the way they treat their bodies and hopefully the environment that we live in will also impact generations to come.
Do you find some tendencies, or some, like we talked about, toxicity, or like the environment, but maybe food wise or nutrition wise? Do you find that there's some tendencies, although I'm sure it's a very individual basis on the coaching programs and all these investigations, but do you find that there's like tendencies to the 21st century? Like if you had like a top 3 of things affecting, or areas affecting fertility potentially?
Well, the environment and environmental toxins, is probably number one. I don't think that stress is far behind that. The stress that we're under as a world today is so much more than it used to be. Now, in different ways, some people might argue, well, many years ago, they were always in constant war and there was always these major diseases and so forth. It's not like we don't have those, but there was a lot more balance and downtime between some of those things. They didn't feel those same impacts directly and as immediately. We are under so much more stress in our current world today for so many reasons. And it's part of it is the beauty that we're all also so much more connected, but that also brings more stress because now I'm more aware. Something happens in Canada, I hear about it within seconds, if not minutes, or whatever it might be, and oh my, what's going on in the world, right? And all of these things impact how we respond, and we're also working, I think, much harder, much more than we ever did before. We always thought that, working later hours, we're not getting as much sleep. And so those things are huge impacts for us. It's very hard to escape work with, our phones, tied to us everywhere. And our email constantly coming in and, we've got to help somebody do something at work. So it's really hard to detach. So I would say, environmental toxins, I would say stress. And the last one we kind of touched on just now is sleep. Sleep is a huge one that I think we are just getting less of, not more of. And that is a huge problem for us and our overall health. And all of these variables when it comes to fertility and reproductive health are going to absolutely impact our endocrine system.
Yeah, I can totally attest to that. And also sleep is so overlooked, and it's really the foundation for regeneration, for health, for handling stress, for a capacity to handle stress. And what I find, like as I said, is so overlooked. Some people will eat healthy, exercise, avoid all those toxins, but will cut on sleep and have like a sleep depth over the years. And many times it will impede many facets of their health. And as a chiropractor, having a very holistic viewpoint on health, I'm far from being a fertility expert and being into more the scope of neuromusculoskeletal issues. Many times we would address the whole patient, and some patients who would suffer infertility or having a hard time conceiving is there a direct link or not? At first I was like, and then they would refer me some patients because they would become pregnant like very shortly after beginning a process with me. And that's why I really resonate with your message, because what I would do, I would optimize their nervous system through lifestyle changes. And it's really back to basics. And when those basics, sleep is the basic, the foundation we really overlook and tend to neglect on most people. Like you said, we tend to, with the artificial light, we tend to be able to chat with someone who's in Canada, the United States, or in a different time zone. And then we, sleep really is a hard one for most people, including myself at times in my life. But then again, identifies a few things to tweak in their diet, for example, maybe a couple supplements here and there to mitigate stress, and from there, those basics, many times some patients would be able to conceive, okay, and fixing their nervous systems and all kinds of physical ailments that would create stress to their body. And then, when it gets more complicated, of course, I don't treat fertility. I'm not a medical doctor and all those things. But then again, this plus sometimes when it becomes more complicated, doesn't mean they don't need the additional help. Some clinics are there for that. But yeah, when the basics are nailed down, many times overall health is better. And fertility is kind of like a symptom or a reflection of overall health.
Yes, 100%.
I don't know if that.
I agree with you. Yeah, no. I mean, I can't. I think you said it very, very well. I believe that often fertility issues are a symptom of other things, which is why I like to dig deeper to find out what's going on. And sleep for me, is so valuable and so important. When I feel my best, it's because I have gotten enough sleep and I have prioritized that. And when I haven't felt great and be able to focus properly, it's because I typically haven't gotten enough sleep. And that's really valuable for me. And I can't tell you how often with some of the couples that I've worked with, all I have done is adjusted their sleeping patterns and timing and rhythm for sleep, and they've been able to conceive with just that adjustment alone. And I hear all the time, well, I don't sleep well, so I just stay up at night and whatnot. We have to prioritize it. I'm not saying it's always easy for us to get to sleep, but if it's not a priority and if we're just staying up because we're binge watching a TV show or trying to catch up with extra work or whatever it is, in the long run, you're causing more problems than you're solving.
And that's very interesting. And also, like, of course, sometimes there's more complicated cases. And I think this is where you and people like you come in, like with, like, let's say PCOS, underlying conditions, fibroids, also autoimmune issues, people like advanced age, or what kind of patients do you work with, or like who would be your ideal, like cases, for example?
Well, we've seen it all over the years, and I love supporting all types of conditions because it keeps things interesting for me. What we tend to see a lot of is more complicated conditions, couples who have been trying for multiple years, have been to many, many doctors, can't find answers or don't know why and haven't been able to get pregnant. We tend to see that quite a bit. So recurrent pregnancy loss, autoimmune issues, invariably egg quality comes up, although I think that's overdiagnosed or over kind of stated, if you will. PCOS is something that's commonly seen throughout. But really for me, my joy, regardless of the case and the condition, my joy comes in when I can support a couple to find answers. Like yesterday, I was on a call with a couple from Singapore and we were discussing their case. And she says, I've always been told that it's unexplained and I don't know why. And they use these terms so freely because they're not looking at the whole picture. So it's a perfect example of what we're trying to express in this conversation, is that when you look at her primary hormones, her main fertility hormones that regulate egg quality and tell you or give you a clue as to egg reserve or ovarian reserve, they looked fine for her age. She was 44. So you expect some of those things to be maybe a little bit lower or higher, but they looked just fine for her age. And so that's why when she goes to the fertility clinic, they're saying, well, we don't know why, it's unexplained. But when you look beyond and you take the blinders off and you actually open up your perspective, your angles of things, then you start to see in her case that there was actually many things contributing to her, to the difficulties and struggles that they were having. One, her husband had poor morphology, and previously had poor morphology, motility, although it had improved recently. So that's one factor. And then she had some genetic mutations that also are a variable for her. And then she had an undiagnosed thyroid autoimmune issue. That was another factor. And then she had low testosterone. Her androgens were low. And we might say, oh, but aren't for women they supposed to be low? Well, yes, to a certain extent, but we don't want them to be so low that they don't exist, right? There's balance with all of that. And I can't remember everything off the top of my head, but it was multiple things, right? And so in her case, as I said to her, I was like, I don't think this is just one thing, right? If you just had this one variable, you could probably overcome it with everything you've already done. And maybe if you just had this one, you can overcome it. But when you have these compounding variables all stacked up against each other, on top of each other, then that makes everything much more challenging and more difficult in your situation, which is why you've been told, oh, it's unexplained. which I don't believe is a real diagnosis. So for her, it was looking beyond that and then taking that information and saying, okay, so these are the reasons why, and now we have to support these reasons to really optimize your opportunity, your chances. Now, in her case, it doesn't mean that she doesn't still need potentially IVF. She's 44, and the conversation I had with them was, okay, because they asked me, do you still think I need IVF? I'm like, well, that's not really a question that I can answer for you. I said, I believe that with enough time, you can get pregnant naturally. But the reality is the time going to be appropriate for you to give yourself that chance naturally? Because if not, if that's a factor that you want to speed up, then really the only way to potentially speed it up, and I say potentially because sometimes IVF doesn't speed up anything, is to do IVF, is to try to maximize your opportunities.
Yeah. There's so many interesting things about what you just said. Not only is this relieving for patients, like when you get told we don't know, well, it kind of like having no solution is stressful by itself. So by just exposing all those factors, there's somewhat of a solution to but also just to understand that, oh, okay, this is why. Okay, now how can we work on XYZ? Okay, so that's super interesting. And also you mentioned about to consider the male part also. We also very oftentimes focus on the female health or the female being the problem, but there's also the male part that's very important to consider. And even the males might have a few of those factors. So I love that you touch base on that. You also mentioned the genetic polymorphisms. I don't know if that's what you were referring to. Mm-hmm. Is it the MTHFR, the methylation pathway? Or there's
in her case it was, yes.
Okay, because that's a very common one, I believe, that people find also. Could you elaborate on that one?
Yeah, so in her case, and this is not when we're looking at polymorphisms or SNPs. In her case, it wasn't just it happened to be the MTHFR mutation, but it's not always the case for everybody when we're looking at it. And she had a relatively mild case because she had only one mutation on one of the genes, on one of the two genes, which is a relatively mild situation, which is why I was saying to her, so in and of itself, this one thing probably wasn't the main reason why you miscarried, and she had multiple miscarriages. But again, when we stack these all up, then I do think in her case it was a bigger issue. Now, the more mutations you have on those genes, then the more of an issue that becomes. I don't often see a double mutation on both. That's very rare for me to see in my work. But that would be certainly a more extreme situation, which would need to be handled differently.
And to get to those, I'm sure you use some lab tests of some sort. Here in Canada, and especially as chiropractors, we're very limited to for lab tests. Even the medical world for now, like with the public health system, it's very limited. But so I'm guessing you're using some lab tests, and you order them and you interpret them.
Yeah, so I was fortunate in her case because she's in Singapore. She was able to just get it ordered, and I don't remember how she was able to do it. In the States, we can do it. Throughout the world, for that one specifically, actually, there's a lot of different resources for how that one can be ordered throughout the world. But other genetic mutations, much more complicated to order and more difficult. And I know from working with couples in Canada, it's very challenging to get a lot of those tests done. But we do work within the program. We do support and work with couples to get the necessary testing that they need. In some places, it's easier than in others. But for the most part, we've been able to get those taken care of for most of them.
Okay. Yeah. And I know you mentioned the thyroid, you mentioned the genes. Do you see some patterns, if you had like a top 3 patterns that you very oftentimes see, or is it very individual to the person? Does it vary a lot, or are there like some big main ones?
Yeah, it varies a lot.
Okay.
on individuals. I will say that I do think thyroid is a huge component that is often mismanaged and overlooked, as well as autoimmune issues. And depending on the condition, I've mentioned it multiple times, but stress is a variable. But I will say, you mentioned men, and in response to me talking about her husband in this specific case, and we started the conversation about statistics, right? The prevalence of fertility issues in the world today versus in the past. And male fertility specifically has declined year over year, especially more rapidly in recent years. And this, to me, is a specific correlation with environmental toxins. And that's what the research has shown. And that's because sperm are so sensitive and volatile that all these little exposures have really seen a decline in male fertility. And male fertility is often overlooked. One of the requirements in my program is that we have a semen analysis done for all partners, because I can't tell you how often, over 50% of the time, it's not done, and these couples have been trying for years, and no one has bothered to look, which just shows you how little it's investigated. But it's so important and so valuable. But even within the IVF world, it's somewhat ignored. Like, even if they know that there's a fertility issue, a male fertility issue, in the IVF world, they believe that IVF will fix it. And when you ask them, oh, why was that embryo no good? They automatically say egg quality. And that's not always the case. So I think we need to move past this understanding and belief that it's always on the female. 40 to 50% of all fertility issues are male factor in some way, and we need to start addressing it more than we do.
Very interesting that you touch base on the decreasing fertility rate for males. There's a documentary I've seen like maybe 10, 15 years ago already now, but it was the disappearing male, I think.
Yes.
I don't know if you've seen, but it was many, many years ago already touching base on that. So I find it very interesting. And do you find that you've mentioned the environmental toxins, and you talk about that a lot in the documentary? Do you find that it's other than that, the very similar to women, or is it different factors that will affect sperm quality and the fertility other than toxicity? Or is it mostly that, according to yourself? Of course, and stress.
No, there's many variables for both, eggs and sperm that impact it. Sperm are just more sensitive to the environmental and chemical exposures than eggs are. Eggs are a little bit more protected, if you will, but still, regardless, the repeated exposure will impact them as well. And I think one of the biggest differences between women and men, again, we're making a generalization here, but one of the biggest differences here is that women, their exposure to chemicals is in a very different way, or in a slightly different way than men, that can impact their egg quality, and that is with all the personal hygiene products that they use. So men use much less personal hygiene products than women do. Women use much more makeup and body care products, not to mention tampons and so forth. And all of those, if they're not organic, if they're not, if chemicals aren't removed and so forth, all of those are used in much bigger quantities and frequency for women. And when we're talking about that repeated exposure, that can have huge impacts on female fertility, much more than men, where men might put themselves exposure more to chemicals outside in the yard or things like that. So they're slightly different in how they're exposed. And I do believe that eggs are a little bit more protected in that regard, but I do think that the repeated exposure over time, that little drip always going in, is a huge factor as well.
Interesting. And that's why I love to have your viewpoint on it, having seen thousands of them. But also it all brings me back to the importance of individualized medicine,
Yes.
like of course the human loves to see patterns and all those things. But then again, I think the big key, especially in tough cases like you work with, is really the individualized way. So, and that's what I've seen in my practice. As I said, I'm a chiropractor. That's not directly what I'm working in, but I've seen so many patients that were doing in parallel, like some IVF or some programs for fertility. And then sometimes I would just ask questions, because health, it's all interrelated. So they would have issues with that, but also sometimes with their lower back, with inflammation and all those things that you can't really separate, and by helping their body, it would help with everything else. And I would find stress to be a big one, the sleep, but also some very, like alpha personalities like CEOs and wanting to have it all. But also it brings me back to what we touched base on earlier, being stressed, but also very simple, being sympathetic dominant, fight or flight. You're not into reproduction mode. This is very sympathetic, so that's how I boil it down to patients sometimes, just to have them understand that when you're in sympathetic dominance, fight or flight, your body is just not into resting and reproducing at all. It's not even the same functions for organs and all those things. So it's a good analogy for it's more complex than that, but still, I like it.
I say that same example all the time to couples. I think it's a really important one for everyone to hear.
Yeah, and from there to see which are the individual stressors or dominant for the patients we have in front of us, but their history also, we all have some very unique histories of stressors or childhood stuff or upbringings or unfortunate events. And then from there, of course, the diet, exercise, and on top of that, the supplements. But many times people want to have the miracle supplement or the miracle recipe. Many times it could work good, but and you have a lot of good content on that, by the way, on your YouTube channel, and on many tips. We've mentioned PCOS and all these other conditions, but you have so many so much good content of little things you can implement before trying to get into more complicated things. And I'm sure you posted those because you were repeating constantly. And also it could, save them, save yourself some work also when you start seeing them if this doesn't work, because as I've heard you say on another podcast, I think it's when is the best time to consult? As soon as you want to start, conceiving, or as soon as you spot a health issue, whether it's PCOS or anything that should not be normal, although common, it doesn't mean it's normal. PMS being one,
Right.
So I really love your content. And although I know a lot about, all these things, I learn constantly just watching some of your videos. So thank you for that. And
that's good to hear.
For the listeners also, and even the health professionals, because many of our listeners are health professionals also. And by knowing that it's out there, that it's something that's out there, not only your Fertility TV channel, but also that you have a referral for patients who want to know more or educate more. I really believe deep down that the key to better health is really to educate yourself and others, really, when you learn something. So, to surf onto the individualized medicine thing, how would you describe, could you take us through how it works when you do a coaching session, from beginning to end?
Well, for me, I don't feel like my coaching and support ends until they tell me they're pregnant, but
well, that would be the end.
That would be the end. No, look, I think the key point, and you've mentioned it a couple times during our conversation, is truly individualized medicine, is that we're all unique individuals with different circumstances impacting our world, our environment, and our body and our health. And we need to account for as much of that as possible when we're looking at somebody. And I often tell couples, I can have 10 PCOS women in a room, and each one might need something a little bit different to get the results that they're looking for based on their history. Or we can use it even in a slightly different way, right? We might say, because we've all heard, oh, we need to change our diet. And we might say that, one of the more common foundational diets that people like to refer to is a paleo or Paleolithic diet. But it doesn't mean that everyone is on the exact same diet. It means that that is the starting point for your individualized diet. And based on your health, your genetics, your history, your lifestyle, then that gets adjusted to fit you as an individual. So you all might be using a Paleolithic framework, but you might not all be exactly on the same diet day to day. And I think those are important variables for us to understand. And this is the way I approach the couples that I'm working with. So when they start working with me and coaching with me, is before we even have our initial call, they have to have our foundational lab work done. So we send them, they join the program, we send them a list and say, this is what we're looking for. And we want it as recent as possible. I'll take anything within 6 to 12 months. Some things I prefer more recent, but like you mentioned, sometimes someone is living in a country where it's a little bit more challenging to get lab work. So we try to be flexible with that. We just want enough of a foundational understanding for where someone is with their blood work, so that we can understand where they are now. And then with that, I also, if someone has historically a lot of information to share, right? They've done the labs repeatedly year after year. I want to see that too, because I want to see the progression. I want to see the history. Where was it? Where is it now? Where do we want to go? Right? So we want to understand all of that information. And then once they have their foundational lab work and they filled out our forms, then we have a 1-hour call where we're reviewing all of that. And I think what's really important for me during that call is that I want to give everyone an opportunity to share their story with me. And some might say, well, I've shared it because I've answered all your questions. That's fine. I still want to give you an opportunity verbally to share your story. You could say that story in 3 minutes. You could say that in 30 minutes. Everybody needs a different amount of time based on what they're comfortable sharing and how much they shared previously. But typically, we understand different information or we hear different information, and at least we can have a conversation about it, with that dialogue. And I always tell everyone, I've reviewed everything you've sent me. So it's not like I don't have that information, but I want to still give you that opportunity. And I have questions that I've generated after reviewing all of your information. And so then I want to clarify those things. And then I also want to give them an opportunity to ask their questions of me so that they can feel heard and understood. And we can both be on the same page and understand what is our objective together to accomplish. For some, they come to me for support because they want to get pregnant with IVF or IUI. Some, it's natural. So we need to understand, and I need to understand, where are you so that I can meet you there and support you in what you need, right? It's not my objective to tell you that, oh, you can only get pregnant naturally and I don't want to work with you with IVF. That's not my place. It's not my journey. It's not my history. It's not my family. It's yours. I want to support you to achieve your goals that you want to see, that you want to achieve, in as natural a way as possible and in as quickly of a fashion as possible. And so that's what we're trying to accomplish in that conversation. And then after that, I create a plan to support them based on all of that and that information. And then we've got to work the plan and we've got to follow up and do all of those things. But that's essentially, how we approach things.
I love it. It's a very individual. It's very human also. It's very, parasympathetic, supporting, building trust, but giving people time to, exchange also. And I think this is very comforting for people also to take the time. That's what's many times not done or out of either a system that's overburdened and all those things. But then again, I love that you do it this way. And regarding the lab tests, I'm curious to know a little bit more about that, and I'm sure the practitioners listening to us are very curious also. But here, like what we have is very basic. So sometimes I'm guessing you're receiving the basic labs, but on top of that, you might order some more specific stuff. Let's say for like, I'm thinking, for example, thyroid. Sometimes like the basic panels are going to be like maybe a bit too limited, or like the autoimmune, like spectrum. Are there some common things that you see that are overlooked in regards to those labs?
Oh, yeah. So we want basic things like, CBC, lipid panel, metabolic panel. Those things are relatively straightforward, although even sometimes in that, things are missing if someone's just getting it ordered by their general provider. But we want that. We want all their fertility hormones. So by that, I mean FSH, LH, estradiol, testosterone free in total, DHEA, prolactin, which is often left out. I might be missing AMH. Those things are key foundational things. Everybody needs to have those done. But also part of my general profile would be vitamin D, homocysteine, the ones I already mentioned, previously in terms of their general panel. But thyroid, I always include a full thyroid panel. Not just TSH, which is often what's just run, and sometimes with that they'll add in, free T4 or T3 or something like that. I want all of it. I want, the T4, T3, free T4, free T3, and the antibodies. I want as much of that information as I can see, because as that example that I keep referring back to from my conversation yesterday with this woman from Singapore is, if I just looked at her TSH and maybe her T4 or T3, I wouldn't think anything of her thyroid. Everything came back fine, and not just fine, like really good, but her antibodies were elevated. And no one would typically order those unless the TSH was abnormal. So that is something that I often see, which is why I just routinely include it for everybody. And she was like, "Oh, I can't believe, no one found this before." I'm like, "Well, they didn't find it because they didn't test for it because all your other thyroid levels came back fine." So that's a really important piece for me in that foundational blood work that everybody needs to have. Also, I mentioned with that, the semen analysis, which has to be included with that as well. Yeah.
Interesting. And how do you see? I have a question for you regarding birth control, not necessarily to demonize it or anything, but I would love to have your input on how it plays into the more modern, because many young girls are put on birth control for many times symptoms, hormonal symptoms, and how it plays into not only the education on fertility. I remember from another podcast you said about like 25-30% of conception rate. If you could elaborate on that and how birth control can play a role into later in life when people are ready to conceive or all those things.
Yeah,
because many girls are just not aware of like how it I'm not about like avoid it at all costs, but just to know like both the advantages, but also the maybe flip side of it.
Look, I think there's two main reasons birth control is used, and I should just let our listeners know I'm not the biggest fan of birth control use unless we really need to control, sexual activity and the concern of being pregnant. But even then, I think that burden needs to be spread out between both the male and the female in this situation. It can't just always be a burden that the female has to incur. And compromise her potential fertility or health in the long run. So typically it's used when there's hormonal issues. There's a teenage girl, maybe they suspect PCOS or other hormonal issues, and they're like, well, we'll just put her on the pill and everything will be fine. Everything won't be fine because it's not really addressing anything. It's not treating the real issues. It's a Band-Aid to get you to, be older, and then when you're ready to conceive, they say, okay, we'll take you off the pill and we'll see where you're at, and then we'll see what we do, and if we can't help you, you just go to IVF. Like, that's not a real solution for these things, and often we see that with PCOS the most, unfortunately. And the solution for these situations is we recognize a condition and an issue that needs to be supported, and we give that individual the support that they need to correct those underlying issues now when they're being formed. And I think that is the most important. If we want to temporarily use birth control, because look, it's so extreme, she needs some relief, let's put her on birth control temporarily while we figure things out and get her the support she needs, fine. But birth control is not a long-term solution for hormonal irregularities and concerns. It's just not. So it shouldn't be viewed in that way, and we've relied on it too much in that fashion, where gynecologists, unfortunately, have become a little bit lazy. Someone comes in, it's like, oh, we'll just put them on the pill, and my job is done. I don't have to do anything else until they're whatever age, right? That's not a solution. We have to work at this and support them the way they need. Now, if someone is really sexually active and we're concerned about pregnancies, yes, I think it can be used in that situation. But like I said previously, that burden shouldn't just be on the female to incur, especially when we're talking about chemicals and hormones that are being introduced into the body. The male has just the same responsibility. I have 2 boys, and you bet they will know that they are responsible when they become sexually active for that piece of the puzzle. It's not just always on the female, and they shouldn't always have to incur that responsibility. One of the first things I did when I started dating my wife, because she was on the pill, I was like, you need to get off. And we were just dating, right? Like, she's like, why? I was like, you don't need to be on it. We can figure this out and make sure that we're careful when we're not, ready. And just like you mentioned, you said at our statistics of how likely we are to conceive. Okay. When we're in our late teens or teenagers and our early 20s, our highest chance of conception is no more than 25 to 30%, which means most of the time you're not going to conceive. Now, the challenging part here is what typically happens is that a female's libido will increase during ovulation. It's a natural occurrence. And so they want to have more intercourse during that time. So the likelihood of conception for a teenager is probably a little bit higher because they're having intercourse when they're ovulating, right? Because their hormones are strong. And so we have to manage that, but I think that could be managed with education instead of scaring these teenagers. We scare them to say, you look at your boyfriend or girlfriend and you're going to get pregnant or you're going to get them pregnant. And that's not the truth. They have a very short window of time where they can get pregnant. And if we educate them properly about that, then the likelihood of them conceiving during that time decreases. You're also teaching them about their bodies and their cycle and their ability to get pregnant. So when it's time, they don't believe it's going to be so difficult. They actually understand when and how they can conceive. There's so many implications to proper education to that. Now, we're not talking about STDs. So, condoms should be used in that regard. And we do have to be careful when we're talking about sexually transmitted diseases. But just from a conception perspective, I think we need to do a better job of educating them.
I love it. Yeah, I love the message. It all boils down to education. Yeah. And basically, if someone, to wrap it all up, if someone is suffering, whether it's any kind of issues or is starting to suspect they're having problems conceiving, for example, top 3 things of where they should start.
So if you think that that there's a concern, or you want to just you want to evaluate things and just make sure, which is a wonderful proactive way to do it, by the way, then I think first and foremost, you start with having your hormones tested, having your partner get a semen analysis, making sure that your fallopian tubes are open. We didn't discuss that, but they have to be open to get the egg and sperm to meet. So those are the top 3 things that we need to do. And I think number 4 for me, and you might want to put this number 1, is that we take a step back individually evaluate our life and our health objectively and say to ourselves, what needs more support? What can I do better? What can I improve? And spend some time doing those things to improve your health. In turn, that will lead to better fertility.
I love it. Exactly, because it's all interrelated. And that's the main message of the whole podcast, and also how it's individualized. But doing this individuation process of, okay, where are my strong points? Perfect. And what do I need to work on personally? Which area of my life? Is it stress? Is it at work? Is it more personal? Is it more my environment? Is it more my sleep? Okay, perfect. Now, here's a blueprint of where I'm going to start. And from there, consult your health professional just to troubleshoot some things if still there's a few things. But many times, as we've discussed, doing the basics first solves a lot of stuff. And if it doesn't for that particular issue, it'll save you a lot of trouble, money, effort when you see that health professional when you're there. So thank you so much for that message. In the end, what would be... well, I think that's our biggest takeaway. Well, that's mine. Like, I was going to ask you the biggest takeaway for our listeners for today, but that would be for me to really start with assessing your lifestyle and sources of stressors. So I don't know if you had have something to add on that, but yeah.
No, I think that's a big one, and continue to believe in your ability to conceive. You know, we lose hope because we see statistics or people told us you can't, or whatever the circumstances are. You can do it. That's what your body was meant to do, was meant to reproduce. And it is possible. You just need to support it in the right way.
Thank you so much for that message. It's very inspiring. And where can people find you online? I'm going to write this in the show notes also. You have your Fertility TV on YouTube, a big channel, but have you a website also and social media? Can you tell us?
I think the YouTube channel is always a wonderful resource for everybody because there's wonderful, great information that I put out regularly there, and hundreds of videos for people to check out. But my website, marcsklar.com, and then Facebook, Instagram, and just a little bit on TikTok.
Perfect. Well, I highly encourage everybody to check your content out. Lots of free resources and lots of training courses, coaching opportunities. So thank you so much for having been with me today. I really appreciate it, and I believe it's going to be super informative for our listeners. So thank you so much and have an amazing day.
Thanks for having me.